It's good to see you all again. Dr. Brown here with your Clinic Minute regarding vaccinations and sports physicals. Here it is July, and thank goodness we still have plenty of summer left. But our minds do wander to August preparations. We have to have sports physicals ready to turn in and school vaccinations up to date. Otherwise, it adds to the stress of school starting. Did you know if you go to cdc.gov, you can easily pull up immunization schedules for not only children, but adults too. If you have ever wondered if you are due for a vaccine at 40, 50, or 65 years old, then it's a great place to start. Chances are your wellness visits at your doctor's office are jam-packed, talking about new problems, medications, or your doctor's concerns. And believe me, reminders to get your shingles vaccination, pneumonia shots, or yearly flu shots can easily be overlooked. I love when my patients inquire about what they may need or be due for. One of my favorite examples of how easily the topic comes up is when a first-time grandparent-to-be tells me their grandbaby is coming in 6 months. Great, let's give you a Tdap, which is a tetanus, diphtheria, and pertussis immunization. That last one I mentioned, pertussis, is whooping cough and life-threatening to infants. So anyone who will be providing care to the infant needs to have an updated Tdap. Generally, we say to give the Tdap every 10 years, but that pertains to the tetanus portion offering protection for 10 years. The pertussis component wanes after about 5 years. So Grandpa had a cut, stitches, and a Tdap 7 years ago. He definitely needs a booster shot at this visit to prepare for baby. So if you go to this schedule, you can see the pre-K age and 11 or 12-year-old age ranges are the big milestones for shots. Across the chart, you will see influenza, which is flu, and this is yearly. I always like to tell my patients that I vaccinate myself and my children for the flu. Unfortunately, young, healthy persons die every year due to the flu. Many people forgo the vaccine because of risk, like the shot made me sick, I got the flu anyway, or who knows what they put in those shots. It is true that some have allergic reactions to consider, are already infected with the virus when they got the shot and were going to be sick anyway, or they received a high-dose flu shot due to their age or risk factors and will be a little sick because of the good immune response they are getting. But the one risk factor that sticks out to me is a disease called Guillain-Barré. Guillain-Barré is a muscle weakness disease caused by an autoimmune disease. But did you know that the risk of Guillain-Barré is greater with the actual flu infection itself? So without a major contraindication, definitely consider getting the jab. An infectious disease specialist can walk you through this if you are a complicated patient or have a history of problems with vaccinations. Sports physicals are generally included with yearly wellness visits, and your doctor's office will have their own standards. But depending on your state, the form may differ. For example, the state of Missouri has a 2-year follow-up box for providers to check, but I still encourage all of my patients to be seen yearly. It's a good opportunity to see our patients, get a thorough exam, review family history, and check on their mental well-being. Until next month, everyone, stay healthy and happy. That was wimpy.